Hello, my name is Marianne Keane. I'm the Chief Administrative Officer here at Peace Island Medical Center on San Juan Island. We serve the residents of San Juan Island and our surrounding community of San Juan County. Here at Peace Island Medical Center, we have our primary care clinic, we have specialty clinics, our emergency department, our 10-bed inpatient department, as well as our other supporting clinics, our infusion center, our cancer care. We also have our lab, our physical therapy, as well as a full suite of imaging services and our surgical services. Prior to March, when our worldwide pandemic hit and we ended up having social distancing and everyone being given our stay-at-home order, our whole world here on San Juan Island changed. And how we had to practice medicine and how we had to care for one another also changed. How we were going to go about caring for one another had to change. And so what we were doing really had to be rethought, and sometimes on an hour-to-hour and day-to-day basis. What you'll notice when you come to the center now, most prominently, I think, is when you arrive at the center, you should be wearing a mask when you arrive. If you don't have one when you get here, we do have masks here. I have one, this is mine. I wear it when I'm not in my office by myself. But when you get here, everyone will be wearing masks. Depending on where they work, they may have a different type of mask on. And you'll notice when you get here, you'll have your temperature checked. We all get a sticker, so you'll get a sticker when you get here. And there'll be a series of questions that you're asked. And we do that to screen for COVID-like symptoms. We are trying to keep everyone as safe as possible and to mitigate this disease, as everyone is, and trying to keep everyone healthy and well. You'll also notice when you get to the building that we've rearranged the furniture. Our lobby has been moved, so our seating arrangements have been changed. We have tried to make sure that there is enough space for everyone as you're waiting to be brought in for your appointment. We ask that people try and arrive for their appointment time. Don't arrive too early. We are trying to make sure that people are here on time, but that people aren't just waiting around. We also ask that visitors do not attend appointments to wait for others. If you do, we ask that people wait in their cars. We also are saying that for our inpatient departments, we don't have visitors except in very limited circumstances. We really are trying to keep everyone healthy and well and limit contact for everyone. We also have changed the way we practice in our clinic. When there was the stay-at-home order, we really noticed that people were not coming to the medical center. We had to change the way that we were interacting with people and taking care of their healthcare needs. So we moved to telephone visits first, and then we moved on to video visits. Those video visits have evolved, and maybe some of you have experienced those. Those telehealth visits have continued in various ways. We also have them for specialty visits. We may be evolving those because we have been able to access some of our specialty visits as well that way. We also have ensured that we have social distancing. So we're asking that people ensure when you're coming in, if someone is ahead of you at the desk and they're getting their temperature checked, please ensure that you are staying at least 6 feet away from the person who's at the desk. And we ask if there's someone 6 feet waiting, that you are 6 feet again away from them. Just making sure that we're following all those same guidelines. If you come in and you don't have a mask, we do have fabric masks available that have been sewn by our Peace Island volunteers. Those masks are available for both adults and for children, and they will be provided for you. You can take them home, wear them all over the island when you're out in public, and just make sure that you are washing them well in between your uses. Now, what should you do if you think you have COVID? So what are those signs and symptoms? It's all over the news. But if you have a fever or you have chills, you have shortness of breath, you're nauseated, you have a sore throat, or you have a new loss of taste of smell, first thing you should do is not come to the center. The first thing you should do is call your healthcare provider. They will screen you over the phone and they will give you advice as to what to do next. Here at Peace Island Medical Center, we do have drive-up testing. I'm sure you've seen on the news, there's all sorts of drive-through testing. We don't do drive-through, we do drive-up, and we only do it by appointment. So you need to call your provider, and if they believe that you need testing, they will have you set up an appointment and they will have you drive up. We do the testing. One of our caregivers, that's what we call our employees, will come out and will do the test for you right in your car. But we do have you pre-registered, and so we have that happen that way. So that testing is available by appointment. Our testing that we do here on island is sent off island once it's done. So it usually takes 24 to 48 hours to get those test results back. Because it's sent off island, it depends on the time of day that we collect that specimen, whether or not it will take 24 or 48 hours because of the time off island and then the result coming back to us. When we first started doing the testing, I know that some of our island residents had very long waits, sometimes 7, 10, I think sometimes 14 days. Some of our tests had to go states away to get tested. As testing has become more regular, and as we have a reliable place, a lab that's able to test for us, that testing has had a very quick turnaround. So we're quite pleased with that quicker turnaround. As testing becomes more available, more reliable, we are hoping that Peace Island Medical Center will end up with our own testing capability here on island, but as of yet, we do not have that capability. Once we do, we hope that we will be able to turn around those tests in 6 to 8 hours. Currently, though, we do have what is called a rapid test. I'm sure you've heard about those tests. Those tests are available with a turnaround time of less than an hour. Those tests are not available for patients with symptoms. That's the first thing to know. So if you have symptoms of COVID, that test is not available. We only use those tests in very specific circumstances and only for patients that are asymptomatic, so patients that don't have COVID symptoms. So why do we use the tests for them? Good question. We only use those tests for patients that are being admitted to our inpatient unit. So the physician has decided that the patients need medical care and are going to be admitted to hospital. We use those tests because we need to know whether or not our caregivers need to wear PPE, specific PPE, so personal protective equipment, that would be needed to care for COVID positive patients while they're in hospital. If the patient is negative, then we don't need to wear that specific PPE. If they're positive, then we know we need to wear COVID specific PPE. So it's important for us to test those patients before they're admitted to the hospital. We also use that rapid turnaround test on those patients that are being transferred to a higher level of care, so being transferred to another hospital. It's important because the other hospitals need to know where that patient needs to be admitted to. Hospitals that are larger, higher level of care can have COVID-specific units or COVID-specific areas within their hospital. So if the patient comes back positive, they want to make sure that that patient goes specifically into a COVID-specific area so that their caregivers can be protected. Again, that's only for patients who are being admitted to our inpatient unit or patients who are being transferred to a higher level of care, and only for those patients who are asymptomatic or don't have symptoms of COVID. For those patients who do have symptoms of COVID, we have to treat them as if they do have COVID. We wear all of our PPE. So just like you see on TV, our caregivers look like they're in big spacesuits with big goggles and shields and those precious N95 masks that you've heard so much about. Or they wear what's called PAPRs. It's those big breathing hoods that you've seen. And we make sure that our caregivers are also going to be protected from this COVID disease. So what happens if you just don't feel good or you have a pre-existing condition? What should you do if you feel like you need to see your doctor? Well, you need to call your doctor. Call your healthcare provider. Call and make an appointment. What we found is during COVID, It's been a scary time. Patients have been afraid, especially with the stay-at-home order. San Juan Island residents, San Juan County residents have been really good at following that order, and they've stayed home. The problem is if you have a pre-existing medical condition or you haven't been feeling well, you've been staying home, and we haven't been seeing you, we want to make sure that you are taken care of. So before you feel too unwell or you let a medical condition, pre-existing medical condition, go too far, please make sure that you are getting the care that you need. Please call your healthcare provider and please be seen. So, what are some of the successes? There has to be something that came out of this exercise of the last few months. Honestly, what I can say is that the team here at Peace Island Medical Center has been exceptional. At the beginning, when all of this was just trickling out of the news, we honestly didn't know what this would look like. The staff, the providers, all came to work every day, not knowing what the day would look like. Sometimes twice a day, we would receive different guidance from the CDC or from WISHA or from the health department. Things were changing so rapidly, and yet every day this team smiled, said, okay, how can we do this? How can we best care for our community? We partnered with our health department, with EMS. We did drills. We worked together. We really had the best interest of the community at heart. And I was really proud to be a part of that team. I have to say, I was really proud of the community and how well everyone has taken the social distancing and the mask wearing. It has been really heartwarming to go out and see how seriously everyone has taken this disease. We have fared very well in the San Juan Islands because everyone has taken this seriously. I also want to thank our volunteers again. I think they've made about 2,000 masks at this point. That has also helped keep our island safe. To close out, I really want to say thank you to all of you for taking this so seriously. Please continue to wear your masks. Call your provider if you have any health issues. And please wash your hands. Stay safe. Thanks, San Juan.